Hi, today we'll be talking about contraception, that is methods to prevent pregnancy. If you are new to my channel, my name is Dr. Nkiruka Bridget. I'm a consultant obstetrician gynecologist. I discuss everything about women's health, children's health, and sometimes men's health on my channel. Please, if you have not subscribed to my YouTube page, subscribe right now at Dr. Nkiruka Bridget at OBGYN Talks with Dr. Adazion. I'm also on Facebook at OBGYN Talks with Dr. Adazion. I'm on TikTok and on Instagram with the same name. So today we'll be talking about contraception. Contraception is the deliberate use of any devices, drugs, methods, sexual practices, or surgical methods to prevent pregnancy. It's actually a deliberate use. You want to do it, that's why you are trying to prevent pregnancy. So that is contraception. There are different methods of contraception. We have from the natural method to the artificial method. The natural method comprises abstinence, calculating your safe days, when you are safe to meet your husband or your partner, that when you are safe to get, when you are unsafe to have intercourse. Because if you meet your husband at that time, pregnancy may occur. So calculating your safe period is one of the ways to prevent pregnancy. Another is total abstinence. When you abstain from sexual intercourse, you definitely not get pregnant. Then the third is coitus interruptus. If for some men that can control themselves, there is a method we call coitus interruptus. Before the ejaculation time, the person withdraws and will not ejaculate into the female reproductive part, and that will help prevent pregnancy. Those are natural method of preventing pregnancy. Now, when we come to artificial method, we have from the barrier method to the use of drugs, to the use of devices, and even to the use of surgical methods. Now, if you go from barrier method has its advantages and disadvantages. We take each of them one after the other. Among the barrier methods include female condom can be used to prevent pregnancy. We have cervical cap, we have the diaphragm for the female. We also have the use of male condom. These are methods, barrier methods to prevent pregnancy. Some of them, one of the advantages is that it also prevents sexually transmitted infection for someone that uses it and using it well. So that is that about barrier method. I will show us some samples as we go on with this teaching. Now we have the use of drugs. We have the one we call pills. It's taken daily for sometimes 21 days, some 28 days, some as long as 3 months, some as long as 1 year, depending on when the individual or when the healthcare provider want the person to see her withdrawal bleed, which is the period. So we have the drugs one, we have the one we call combined oral contraceptive pills, which comprises of estrogen and progesterone, the hormones. It mimics the natural hormone in the body. Then we have the one we call just progesterone. It's also a pill, the mini pill, progesterone only. For some that have contraindication to taking this combined oral contraceptive pills, they go for progesterones only. I have them here. I will show us the sample. Then we have another one that we also know as injection. We have the one that we can inject every 2 months. We have the one that inject every 3 months, 3 months. All of them are hormones. They are hormonal contraceptives. They try to mimic the hormones of the body, thereby sometimes preventing ovulation, sometimes tickling the cervical mucus. That's their method of preventing pregnancy. Now, if we go to devices, we have the one we call intrauterine contraceptive device. This one is put inside the woman's body, inside the uterus, and you'll be feeling the strings outside. So it helps the person to note that this device is still there. It actually prevents any form of number one, it prevents fertilization from happening. It becomes also thickening of the cervical mucus. It prevents the sperm from going to meet the egg for fertilization. These are their methods. Then we have the devices, the one we can use, put it in the body, especially on the upper arm. We have the jade, it has 2 rods. We have the implanon. They have different mechanism of actions. However, all of them are contraceptive methods. Then if we go to surgical methods, we have the use of mini surgery where we can just clip off or cut off and tie the fallopian tubes. You know, the fallopian tubes is where the eggs are transported. So, and that's actually where fertilization occurs before the fertilized ovum are transported. So when we do a mini surgery and remove and cut off the connection between the fallopian tube, the egg, there will be no fertilization because the sperm will not migrate to meet the egg. Any egg that is released during ovulation will not be passed to the uterus. Um, these are method of surgical method of contraception, that is preventing pregnancy. We have the one that we can do for the man, which we call vasectomy. We just go to the vas deferens, which is just behind the scrotal sac. Inside the scrotum, make a nip, get the vas deferens, clip it, cut it off, and so that sperms will not be transported to the penis, to the phallus when intimacy is happening. So even if there's an ejaculation, there will be no sperm into the semen. So these are methods of contraception. Let me show us the pictures, then I will take each of them one after the other and discuss. Thank you. This is the injectable. This is the injectable. This is not testosterone enanthate. This one is taking 200 milligram. It's taken every 2 months. It's giving, the person takes the injection every 2 months. And this is another one. This is the Depo-Provera, you know, it's taken every 3 months. It's taken every 3 months. So if the person does not want pregnancy, it takes it every 2 months. If the person is comfortable with this one, if the person is not comfortable with this one, you can choose the other ones that I'm going to mention. To my page again. If you have not subscribed, please subscribe at this point. Hit the notification button. Follow me on Facebook or at OBGYN Talks with Dr. Adazion. I'm on YouTube at Dr. Kiroka Bridget at OBGYN Talks with Dr. Adazion. I'm on TikTok and on Instagram with the same name. Thank you for subscribing. Now let's go on. If you look at what I'm holding, this is the male condom. This one has 3 in a pack, and it's actually easy to tear. Just follow my method. Very easy to tear. This is one pack. So I've gotten one. Instead of using your mouth to open it, this is the method to open it. See? Very easy to open. Hope you are following me. This is the male condom. No matter how big your phallus is, it will definitely enter. No matter how. So this is put on the phallus and then you start wearing it down. So this is the male condom. It had some oily this thing on it. It helps for easy penetration. So you go on, even if you like, let your phallus be as big as the biggest cucumber on earth. It will enter it because it is stretchable. You can see. So you're not supposed to use your mouth to open it. This is the male condom. This is it on my thumb. I have a model, but I don't want to bring it yet. When I will teach properly about male condom, its advantages and disadvantages, I will bring it. But this is a picture of the male condom. This is that for male condom. Now let me show us. I don't have the cervical cap here. I don't have the diaphragm here. But this is male condom. Now let me show us the tablets. I have a pack of progestogen only tablets here. This is the tablet, and this is the way it looks. This is how it appears. It has an arrow on how it can be taken. If you look well, you will see. So you start from one end and take it gradually until it is 28 pieces here. This is for progestogen. Remember I said there are different types of pills, the one you swallow. We have the progestogen. This one only contains progesterone. Then we have combined oral contraceptive pills. This is combined oral contraceptive pills. It's also 28 in number. It has both progesterone. This one has levonorgestrel and ethyl tablets. Then it has 21 active pills and then 7 placebo. These placebo are ferrous fumarate. They're actually blood tonic. This is it. So when taking for 21 days, it will help. This one, when you start taking this placebo, the person will now be preparing to see her period. This is this. I will teach this too in another episode of this teaching. This is for pills. Now let's go on. We have the one we call implants. If you look at this diagram, you will see two rods. Just take a look. I'm showing these are the two rods. This is the first rod, this is the second rod. This one is put on the upper arm. It is put here. Is another contraception. It has levonorgestrel. Each of them has, so each of those rods are levonorgestrel. They are progesterones. It contains 75 milligrams of progesterones. They are inserted in that place and is left for 5 years. This one offers contraception for 5 years. I hope you can see it well. This is Jadel. The name is Jadel. It's an implant. Now we'll have a sister to this, which is Implanon. This is Implanon. This is it. This is Implanon. This one is already loaded. All I need is to wear my glove, make the place sterile, and put it also on the upper arm. I'll bring it out, punch it in, and withdraw. Immediately it enters, it clicks, and I just bring out my destiny. So this is Implanon. This one offers contraception also. It contains 68 milligrams of etonogestrel. Contains 68 milligrams of etonogestrel. Hope you can see it well. This one is Implanon. 68 milligrams of etonogestrel. That is that for Implanon. Then we'll have another here that is look very well. Trying to see if my camera, okay. Look at this. This is the intrauterine contraceptive device. It's like a cross. Look at this. Then this thing. This thing you are seeing here is what we use to measure. This is what we use to insert it. If I bring it out, it's just a very tiny something. This. We put it into the uterus and it stays in the uterus and balances there. It has its own method of contraception. So these are, we have another one that is just progesterone. Can just put inside. This one is intrauterine contraceptive device. It contains copper. It's called copper T. This one is copper T. We have another one that is progesterone. Each of them has their disadvantages and advantages. However, all their mechanism is to prevent pregnancy. Now, there are some of these that I showed now that their use may affect the way the individual uses it may affect its ability to work perfectly well. However, these ones that are put inside will just stay there. This one is IUCD, copper T, and is actually sterile. So these are the methods of contraception that I have here with me. So these are methods of contraception. I'm just doing an introductory lecture to this contraception. Every other method will be discussed individually, so it's going to take us a long time. If you have not subscribed, subscribe to my page. Follow me on YouTube at Dr. Kiruka Bridget, Talks with Dr-Adazion. Follow me on Facebook at OBGYN Talk. That is OBGYN Talks with Dr. Adazion. I'm on TikTok and on Instagram with the same name. Thank you for watching to this point. See you next time for another beautiful episode. Enriching medical talk. That is what we'll discuss here. Thank you.